Way back when I started working, HR or human resources was not even an industry or even called human resources. So I was studying in college and I received an internship, and it was in a human resource department in a jewelry manufacturing company. And the vice president of human resources thought I had a lot of potential.
I had the opportunity to participate in the first IT programming class in my high school. And I thought it was a lot of fun, and I thought this is something new, it's a new opportunity for me, and I knew that's where I wanted to go with my career. So I went to Bryant and majored in computer information systems, and I came out a programmer.
I actually have not one, but 3 degrees in sculpture, and I think when I moved to Providence, I had no idea what I wanted to do, and kind of fell into business management, and then into nonprofit business management. Kind of worked my way to where I'm at today at the library.
I had a strange path. On my 16th birthday, I went to work at a hospital in my hometown, Gloucester, Massachusetts. And I started in the stockroom. And I just loved the whole hospital environment. So I worked there all the way through high school, all the way through college, and actually when I was in graduate school for hospital administration. So from the very first day I walked in, I wanted to work in a hospital. And that's how I got started.
A lot of people ask how I ended up in this position. I went from delivering point-of-care information technology tools for physicians to implementing population health strategies that, from an enterprise level, would not only suffice the information technology needs of the members, but also meet the clinical needs of the many diverse patients in which our physicians serve.
So my career started off actually in the publishing industry in computer books, and I then went to a PR firm doing high-tech public relations, which ultimately was not going to get me out of bed in the morning. So when my husband and I moved to Rhode Island, I thought I need to take these skills and do something that it's more meaningful and that I really care a lot more about. And I was lucky to stumble into the job at the food bank.
Early on, I knew that I wanted to be in a business environment, but I wanted to be in a role where I could truly connect with people and help them somehow. So my first role was an HR coordinator, and I instantly fell in love. After that, I shifted gears a bit, went into marketing, and I enjoyed that as well, but my heart truly belongs in human resources. That's really where I thrive.
As a child, I had speech impediment. I spent most of my life in speech therapy classes, so when it came time to go to college, I looked at a career that I would not have to talk so much. So that's why I ended up going into accounting, and it just evolved from there. I was a little bit wrong. You do need to talk a little bit, and communication's a big part, but that's really how I led towards accounting and finance.
I pursued this career as something that I enjoyed, helping people, working with community members, and improving their lives. And so it's something that came naturally as an extension of the work that I was passionate about.
I certainly didn't spend my childhood dreaming about a career in health insurance. I don't know that anyone does necessarily. My career is a really interesting mashup, though, of both my parents' experiences. My mom's a healthcare professional still. My dad was a longtime business executive and entrepreneur, and when I think about what I do today, it's really the blending of healthcare and business.
HR has significantly changed over the years to be much more strategic and more visible, less administrative. And it's really about cultivating your culture, bringing your values to life, and engaging your staff. It's about creating a work environment where your employees want to go every day.
The role has changed in that we've really deliberately introduced a very segment-focused model. So a business around Medicare, again, is very different than a business around group or small business. And defining that and identifying both resources and priorities different for those customers is a lot of the work that I brought to Blue Cross.
I think what's changed the most is the speed at which colleges and universities need to operate now. I think they've long been perceived as places that take their time and are contemplative in their decision-making and processes, and that can't be true any longer. It's a very competitive environment, and that's caused us all to really need to work faster.
So my role in IT has evolved over the last decade, probably because I went from an IT organization, a large IT organization in corporate America, to a small IT organization in healthcare. So although both aspects are very similar, there's different rules and regulations, that come with healthcare that you need to stay on top of?
I think over the past couple of years, I think the needs have gotten greater for members in the community, and we're looking at ways in which populations are dealing with multiple needs, whether it be housing, whether it be educational needs.
It's evolved from an administrator to a manager to a leader. And if I can summarize what I try to do every day is lead the organization so that we provide the safest care we can and the highest quality care we can to our patients.
So technology is really important for the food bank in so many ways. I think the way it's changed the most over the last 10 years is in terms of our communications and how we tell our stories and how we get the word out, and really figuring out how to be good at using social media and using email marketing.
Technology is key. A lot of the renovation itself is upgrades to technology, but the ability to walk around the building with an iPad and pull up the set of plans and actually look at a room, what it's going to look like, what you're looking at.
Being able to target our strategies with limited resources, being able to know the impact that we're having, and so technology has been really useful in utilizing data to drive our work and to be able to measure our impact.
I think what's most telling about technology in our field is the amount of data that becomes available to you now is an enormous range of data. And I think what we really need to focus on is making sense of that information.
Being in the long-term care industry, not only do we have to also worry about the phishing scams, the hackers, the number of passwords that people need to maintain, but also HIPAA-related issues regarding patient privacy. So it has become a challenge.
Find a mentor. You need help. I've had great mentors over my career.
So a mentor can really help in a very safe environment to let a young professional know the areas that they need to develop or the blind spots that are getting in their way of their advancement.
Start at the beginning, start at the grassroots of the organization, understand how the organization operates on a day-to-day basis.
Remain positive. I think you can feel that energy, and when people see a positive person, they want to be around positive people.
But you also need to have a job in a position where you like to go to on Monday mornings, because life is full of Monday mornings.
I would say you're going to make mistakes along the way, and that's okay. It will be daunting sometimes, but it's okay to make mistakes. That's how we learn and grow.
So the best part of my job is when I can help people roll, whether it's a technology solution or just a simple fix, and it makes their work life easier.
I'm doing many different things, which I absolutely love. I can't imagine, sitting in a cubicle every day doing the same thing.
We are the Rhode Island Community Food Bank, and so we really do touch all aspects of the community, and I think that keeps it interesting and inspiring for me.
We actually do make a difference or help find funding for a recreation program or a breakfast program at the school. When you really see what you're doing has an impact on people, that's when I think you get the most joy.
But I would say it's the connection with the people. It's really about nurturing those relationships and truly getting to know each individual on not only a professional basis, but a personal basis.
I live in southern Rhode Island, and I was very unprepared for the amount of traffic on the roads. My team laughs.
We are helping people, but we are not necessarily ending hunger yet, and I think about moms like me opening their cabinet and not having enough food to feed their kids, and I think that's the hardest part of the job, is knowing that there's still need out there and that people are struggling.
It's also the people. There are some challenging people to work with in any environment.
Not having limitless money. I wish we had more money, and so being able to raise money specifically for the needs of our community is a challenge.
The least favorite part of my job is when I can't make technology solutions easier for people.
There's one big thing that I don't like about my job, and that is the employee termination process. It has not gotten easier after 30 years in this business.
Spend time with my children and my family, relax. It's busy work, and so any time where we can just be together.
I like to play classical piano, so that unfortunately is a quest that I'll never be proficient at, but that doesn't stop me from trying.
I have 2 girls who play sports, and I am their loudest cheerleader.
I enjoy playing guitar. My family is very patient with me when I get home. It's an opportunity for me to decompress after a long day.
I do still love to make artwork and show, around town. So that's kind of still my love beyond my professional career.
My husband and I like to travel with our 2 sons and explore new places. It's really fun to see things for the first time as a family.
I take an annual Red Sox road trip with my sons. We hit a different ballpark every year, which is enjoyable.
Well, I used to sail, but I'm boatless right now, so if anybody's out there has a boat, call me. I curl out of Cranston. There's here in Rhode Island a curling league.
So I love to spend time with my family, my husband. I have 2 teenagers. I work at the food bank. I like food, so I like to cook and try new restaurants and eat out.
So I really try to carve out a lot of time to spend time with my family and friends, laugh, and just embrace the moments because life is so fleeting.